All right, welcome. You're ready to dive into some deep stuff today. We're going to be talking about existential therapy, which really gets at, like the core of what it means to be human.
Yeah, for sure.
It's about choices, freedom, responsibility, and like how we create meaning, in a world that doesn't always hand it to us on a silver platter.
Exactly. It's kind of taking ownership of your life, right?
Yeah, exactly. And so for this deep dive, we're going to be looking at these transcripts from 3 YouTube videos by Dr. Russ Curtis. He's a professor of counseling. The videos are called Existential Therapy, NCE Prep, How to Apply Existential Therapy in Counseling, and The Essence of Existential Therapy. And he does a great job, I think, of explaining existential therapy, both the theory and how it actually works in practice. So our mission for today is to kind of pull out, the most important and interesting parts of these videos so that you can walk away with a solid understanding of existential therapy and, how it might relate to your own life and your own search for, well, for meaning.
Right. And maybe even spark some new questions or insights, too.
Yeah, yeah, exactly. So let's start with the basics.
Okay, so the core philosophy, right? Like,
Right.
where does this all begin? Well, existential therapy really boils down to, as Dr. Curtis puts it, choice, freedom, responsibility, and self-determination. It's about recognizing that you have the power to shape your own life.
Yeah, you're not just a product of your circumstances, right?
Exactly. You have agency.
Yeah. And it's interesting because existential therapy is kind of grounded in some pretty heavy-duty philosophy, right?
Right. It goes way back.
Yeah. Like Dr. Curtis mentions people like Rollo May, Irvin Yalom. I think you can even find some videos of Yalom on YouTube, by the way.
Oh, cool. I'll have to check those out.
Yeah, definitely. And Viktor Frankl, of course. And he talks about how their work really builds on the ideas of philosophers like Nietzsche and Kierkegaard.
Yeah. Especially Kierkegaard and his emphasis on like individual subjective truth that's so central to existential therapy.
Yeah, and I think that ties in really nicely with this concept of self-awareness, which Dr. Curtis talks about a lot. It's not just about being aware of your thoughts and feelings, but like recognizing that you have the freedom to be yourself, to move beyond maybe societal expectations or even, the expectations that your family might have had for you.
It's about kind of breaking free from those predefined molds,
Yeah,
right?
yeah, exactly. And it's empowering, but it's also it comes with responsibility.
Right. That's the flip side. It's like this beautiful paradox, right? You have all this freedom, but with that comes the responsibility to make choices and to own those choices.
Yeah. And that leads us to another big idea in existential therapy, the meaning of life.
Ah, the big question.
Yeah. So existential therapy doesn't say that life has some inherent predetermined meaning, waiting for us to discover.
Right. It's not about finding some grand cosmic plan, is it?
No, it's actually kind of the opposite. It's about us creating our own meaning.
So it's about defining what matters to you, what gives your life purpose.
Yeah, and that can be exciting, but it can also be kind of scary.
Yeah, it's definitely a challenge. I mean, it puts the ball in your court, doesn't it?
It does. And speaking of scary, another thing that existential therapy looks at in a unique way is anxiety.
Okay, how so?
Well, Dr. Curtis says that anxiety can actually be a teacher. It might be a sign that you're not living authentically, that you're not in alignment with your true self.
So it's not just something to be avoided or medicated away.
Right. It's like a wake-up call.
Yeah. And it can be about choices too, right?
Yeah.
Like maybe you're anxious because you're in a job that you don't really care about or in a relationship that's not really working for you.
Yeah. Yeah. And those are tough things to face, but facing them is kind of the point.
Right, because that's where the growth happens.
And then there's death.
Whoa, okay, jumping right into the deep end.
Well, it's a reality, right? And existential therapy actually sees confronting our own mortality as a way to find meaning.
Really? Sounds kind of counterintuitive.
It does, but Dr. Curtis says that thinking about our own death can make us really examine how we want to live our lives. It can help us figure out what's truly important to us, what we want to accomplish with the time that we have.
So it's about like shifting your perspective, using the awareness of death to kind of fuel your life, make it more meaningful.
Yeah, exactly.
Okay, so we've talked a bit about the philosophy behind existential therapy, but what about its goals?
Well, the goal is to help people live more authentically, to take ownership of their choices, and to create a life that is meaningful to them.
Yeah, so it's not just about understanding your problems, it's about like moving forward, making changes.
Yeah, and to do that, you need self-awareness. That's a big
Yeah.
part of it. And also, recognizing those limiting beliefs that might be holding you back.
Like those shoulds and have-tos that we all carry around with us.
Right. Yeah, the things that we tell ourselves that might not actually be true. And then there's the relationship between the therapist and the client, which is a really unique aspect of existential therapy.
Yeah, Dr. Curtis talks about it being a shared journey,
Hmm.
and he uses this term I-thou dialogue. What does that mean exactly?
Well, I think it's about creating this really genuine connection between two people where both people are, kind of fully present and authentic. It's not just the therapist as the expert and the client as the patient.
Right, it's more like a partnership, a collaboration.
Yeah, and Dr. Curtis even mentions this thing called the session rating scale, which is a way for the client to give feedback on how they're experiencing the relationship with the therapist.
So it's about being really transparent and open in that relationship, which is, kind of a model for how you might want to approach other relationships in your life.
Yeah, exactly. And it can help you, develop more assertiveness and authenticity, not just in therapy, but in your relationships outside of therapy, too.
So the therapeutic relationship is kind of like a practice ground for real life.
Yeah, exactly. And that brings us to the techniques used in existential therapy, although Dr. Curtis kind of says that the relationship itself is the biggest technique.
Okay, that's interesting. So it's not so much about having all these fancy tools and interventions.
Right. It's about the connection, the shared journey.
I see.
But there are some specific techniques, like immediacy, for example.
Right. What's that all about?
So immediacy is about like directly addressing what's happening in the moment between the therapist and the client. Like if the therapist notices that the client is getting really tense when they talk about a certain topic, they might bring that up.
So it's about being really present and attuned to those subtle cues, those nonverbal messages.
Yeah, and it can be really powerful because it helps the client become more aware of their own patterns and reactions.
Right. And then they can start to, experiment with new ways of being, both in the therapy room and in their lives outside of therapy.
Yeah, and Dr. Curtis talks about how Yolam was a big proponent of immediacy, and he suggests watching tapes of experienced therapists to see how they use it.
Oh, that's a great tip. I'll have to look for some of those.
Yeah, definitely. And I think it's important to remember that, existential therapy really values the individual's experience and perspective. It's not about the therapist imposing their own beliefs or values on the client.
It's about honoring the client's unique way of seeing the world, right?
Yeah, exactly. But Dr. Curtis does point out that there's a potential criticism of existential therapy, which is that it can sometimes be a little too focused on the individual and not really take into account the influence of, like environmental factors or cultural factors.
Yeah, like systemic issues that can also play a big role in people's mental health.
Right. And that's definitely something to keep in mind. Okay, so let's go back to anxiety for a second.
Sure.
We talked about it being like a teacher, but what does that actually look like in practice?
So, practically speaking, if a client comes in and they're struggling with anxiety, the therapist might explore with them whether that anxiety is stemming from, choices that they've made that aren't really in alignment with their values.
Can you give us an example?
Yeah, so let's say someone is feeling really anxious about their job. The therapist might explore with them, whether they actually enjoy their work, whether they're passionate about it, or if they chose that career path maybe because of, family pressure or financial security.
Like they felt like they had to, not that they wanted to.
Exactly. And that disconnect can create a lot of anxiety.
Yeah, so it's about really examining those choices and figuring out what's truly important to you.
Right. And making sure that your actions are aligned with your values.
And how does immediacy fit into all of this?
Well, like we said, immediacy is about addressing what's happening in the relationship between the therapist and the client. So if a client is, like avoiding eye contact or giving really short answers when a certain topic comes up, the therapist might say something like, I notice you look away when we talk about your relationship with your sister. I'm curious what's happening for you in those moments.
Yeah, just bringing it to the client's attention.
Right, and that can be really helpful because it helps the client become more aware of their own patterns and their own defenses.
Yeah, and Dr. Curtis talks about how Yalom used immediacy really effectively in group therapy. Like he would actually address the judgments that people had about each other right there in the group.
Whoa, that's pretty intense, but I can see how it would be effective.
Yeah, because it forces people to be more honest and authentic with each other.
Right, and that's what existential therapy is all about, isn't it?
Exactly. And Dr. Curtis really hits on this idea of authenticity in the third video, the essence of existential therapy.
Yeah, he really emphasizes the importance of relationships, right?
Yeah, he says that the core of existential therapy is about helping people build authentic relationships.
So it's not just about the individual, it's about how they connect with other people.
Right. And he says that, like if a therapist can build a really genuine and authentic relationship with a client, then the client can kind of use that as a model for how to build other authentic relationships in their life.
So it's like learning by example, experiencing what a healthy, authentic relationship feels like.
Yeah, and Dr. Curtis believes that, as people develop more authentic relationships, they're going to have more support, more connection, and ultimately they'll experience less, mental health issues.
So it's not just about feeling better individually, it's about creating a more supportive and connected community.
Exactly. And I think it's interesting how he connects existential therapy to other approaches like feminist therapy, relational cultural therapy, reality therapy, and even CBT.
Yeah, he's saying that there's this common thread running through all of them, this recognition of how important relationships are.
Yeah, and I think the big takeaway here is that if you're interested in existential therapy, it's not really about finding the right therapist who has all the right
Right.
techniques.
It's more about finding a therapist who you can connect with, who you can be yourself with.
Yeah, someone who can really see you and accept you for who you are.
And that's a powerful thing.
It is. Okay, so to sum up, existential therapy encourages us to really dig deep and examine our choices, our responsibilities, and the meaning that we create in our lives. It sees anxiety as a potential signal that we're not living authentically, and it emphasizes the power of genuine relationships for personal growth and well-being.
So much good stuff in there.
Yeah, and with that in mind, we'll leave you with this thought. Take a moment to think about the times in your own life when you feel the most free, the most responsible, the most like yourself. How do your choices reflect those moments? How do your relationships support or challenge you in those areas? It's something to really ponder, and maybe even talk about with someone you trust.
Food for thought, for sure. Thanks for diving in with us.
Yeah, thanks for listening.